Dr. Kahng, I have an important subject here called periodontal disease, gum disease, gingivitis, really all the same. Periodontal disease and gum disease, really the same meaning except different language. Gingivitis, same thing, just a little bit less of a gum disease than a full-blown periodontal disease. Now, here's the question, or the statement. Almost every dentist will tell you that if you do not take care of your gum disease, you will lose the teeth. You will lose all your teeth. And that's bad. We know that that's bad. You will have dentures or implant-supported dentures, or you'll have implants. Either way, it's lots of money. It's operation. It's just, why do it if you can prevent it? It's just not a good thing. However, here's what I look at it and what I lately hear, and that is this. While you're losing the teeth, losing the teeth doesn't look to me, it's a bad thing, but it doesn't look to me so bad because you dentists really do good dentures, good bridges, good implants. So it's not anymore like George Washington, which had a wooden tooth, and that must have been awful. You're doing a good job, but while you're losing the teeth, that takes a year, 2, 3, 5 years, whatever it takes a long time. Not only do you have a very stinky mouth all the time, and it's a bad stink. It's not like eating an Italian garlic dish, or something, which is stinky, but it's a different stink. But also, you're ruining your liver, your kidney. You're having diabetes problem. Women get babies which are premature born and underweight because of it. Heart attack, stroke. That has been said many times by dentists, but I don't think they're making people aware. But there's also those other things which I just mentioned, simply because you have that yellow, ugly pus, that infection, like if you have one on your finger, it's that yellow, ugly woo, and it's in your gum, in your mouth, and it drips down into your bloodstream, which is a very open wound here. Not only does it drip down into your bloodstream, but it gets, when you eat a meat, an apple, and you chew it, you nicely clean it all out here. It gets into the meat, it gets into the stomach, and it spreads from there too, because that's what infections and bacteria do. And it looks to me that is a much bigger problem, because at least the teeth can be replaced. But once they get replaced with an implant with many thousands of dollars in your whole mouth, you suffered ugly, you were stinky, and you ruined your liver, your kidney, you got your diabetes higher, and it simply cannot be fixed anymore so easy.